Hi friends, this is your friendly neighborhood pediatrician Dr. Aditya Bhatt, and today we'll talk a bit about alagille syndrome, or some of you might call it as alagille syndrome. So it is a jagged one notch pathway abnormality. So what happens in this condition is that there is bile duct paucity. Now what is bile duct paucity means there is abnormal development of the bile duct, and how to quantitatively measure it. The bile duct to portal tract ratio is less than 0.9. So this bile duct paucity manifests as cholestasis. Usually there is associated vertebral abnormalities, the bone abnormalities, not the spinal cord abnormalities. So there is presence of butterfly vertebra, and there is ocular anomaly in these patients, which might manifest as posterior embryotoxon. Now, renal system is also involved. So there is the most common renal system involvement in this condition is dysplasia, and the least common is VUR. Now, these patients have a typical triangular faces with a prominent forehead, deep set eyes, hypertelorism, pointed chin, saddle, straight nose, and bulbous nose. Now, when would you call a patient as hypertelorism or a the eyes are widely spaced apart? So you call it when the distance between the two eyes is more than the intercanthal distance is more than a distance of the one eye. So that is when you call it as a wide spaced eyes or hypertelorism. There might be presence of intracranial bleed. Now these patients, when you do the blood investigation, there is very high cholesterol level, more than 1000 2000 milligram per deciliter, but these patients have no increased chance of coronary artery disease, because the cholesterol the cholesterol that is increased in this resists the oxidation. As we all know that the trans fat and the oxidated fats are the problem which causes coronary artery defect. In these condition, oxidation does not occur, and there is increased cholesterol, but there is no increase of coronary artery disease. Now, these patients also might have peripheral pulmonary stenosis. Could you please comment down below that what are the other causes of peripheral pulmonary artery stenosis, and what type of murmur do you hear in peripheral pulmonary artery stenosis? So in patients with alagille syndrome, there is presence of peripheral pulmonary artery stenosis. That's all for today, guys. Hope you liked it, and if you liked it, please like, share and subscribe. Thank you.